do a screening CT chest, and also we can look at the coronary arteries for the calcium. This is different than when they do what they call a coronary CTA, which is CT angiography. That's where they give you contrast, and they really get a good picture of both the calcified and non-calcified plaques. What they developed is a quicker screening method just for looking at the calcium burden of your coronary arteries. And
so we're trying to see how we're doing as far as health of the heart?
Yeah, and then like your, what your heart status is. In other words, this is
your likelihood of having
a heart
cardiac
disease.
problems.
Yeah,
okay.
Like if you're having existing heart disease and if you're at risk for developing a myocardial infarction, like a heart attack.
Right, okay.
So, this is something that the cardiologists use to stratify patients to see if they need to do further workup, either through the coronary artery angiogram, traditional angiogram, or the coronary artery CT angiogram. So,
okay. All right.
And then basically just to show you, so we get a very good idea of the structure of the heart. These are the great vessels, including the pulmonary arteries, the aorta. But then when you look at the individual coronary arteries, we get a good picture of the LAD, the left circumflex, the obtuse marginal, the right coronary artery. And what we're looking for is there any calcification that we can measure? And then what we do is we can give you a score. Once we give you a score, then that stratifies your risk. In this case, you have a very good heart and coronary arteries.
Yay.
So your score was 0.
0, okay.
And how? So just so you know,
it doesn't mean I'm
right. Doesn't mean you're completely out of the
right.
clear. You still need to be healthy and and follow your doctor. And if you do have chest pain, you need to see your cardiologist. You may need a stress test because there are some lesions in the coronary arteries that are not calcified.
Oh, okay.
And those actually are the ones that can be more deadly because those are more acute injury to the wall. They can cause the thrombosis, which then goes downstream and causes the heart attack. But at least, at least we can say that you haven't had a lot of damage to the coronary arteries.
You don't have the buildup. That's what you're looking for. Okay.
Correct.
Okay.